And speaking of listening, I'm sure you guys are ready to listen to our next speaker. Now, this next speaker of ours is sure to give us the 411 on wavelength in health and politics. He is currently the Executive Vice President of the University of the Philippines System, Chief of the Trauma Division of the Department of Surgery at the Philippine General Hospital, and is the presiding chairman of the board of the non-profit organization Physicians for Peace Philippines. So with that, let us call on stage Dr. Chidoro J. Herbosa.
Good afternoon, Tedx Ust. Good afternoon. I love the theme. The theme is wavelength. And as you heard, the definition of wavelength is the distance between two wave crests moving continuously in motion. And I'm going to talk about the waves and crests in my life, the things that actually affected and changed. And with that, I hope we'll have convergence, and I hope I'll be able to inspire. My real nickname is Ted. And I'm really very happy to be here because that's the idea. When I was in high school, I loved martial arts. I studied arnis. I learned the skill sets and the discipline and the philosophy of arnis. And then I realized, according to Jim Rohn, discipline is the bridge between goals and accomplishments. Arnis in my high school taught me to fight. It taught me to innovate. It taught me to think fast. And it taught me to actually just become a warrior. Today I'm not going to talk about arnis and my martial arts background. I'm going to talk about what I've become. I studied medicine and I became a medical doctor. I trained to become a surgeon and I became a trauma surgeon. And this is my passion today: trauma, emergency, and disasters. Interesting, I've told you my first TED, my name. My second TED is my passion. And the third TED completes it, my TEDx talk in UST. So my life has been a lot of advantages. There's a lot of waves and crests, like a surfer surfing the big wave. I've become an academic surgeon. I concentrated on training young people like you, teaching in another university, medical students, surgical residents, fellows. And I was invited to become a member of the faculty of the very first trauma surgery division in the Philippines, the Philippine General Hospital Division of Trauma. And I had the opportunity to actually create that program for other surgeons to become leaders in the field of trauma, emergency, and disasters. Today, it still stands as a single program that trains the trauma leaders of this country. Eventually, I worked as well with the Department of Health at the time of Secretary Flavier. I was asked to join the Jose Reyes Memorial Medical Center, again training the young surgeons there to become good at trauma and emergency. In the process, they asked me to develop a Department of Health program in disasters, which we called Stop Death Program. I'll tell you more about what we developed. But I got back to the Philippine General Hospital because they gave me a job. They gave me a job as a head of the biggest emergency department in the country, the Philippine General Hospital Emergency Department. And I ran it for 12 years. I created the first university-based emergency medicine residency program and another program for people that ride the ambulance, the Emergency Medical Technicians Training Program. I'll talk a little bit more about the hospital preparedness for emergencies in my subsequent slides. So the waves in my life continued. The work with the Department of Health, the disaster program, Stop Death, got recognized by the World Health Organization. They offered me a scholarship to study in Geneva. So I studied in the University of Geneva in the very first pioneering diploma course in health emergencies and crisis management. A pioneering effort at that time. And eventually, when I got back, I started to work with a lot of WHO programs in the region and the rest of the world, analyzing health policies and programs for different countries with the World Health Organization. I also got invited by the Asian Disaster Preparedness Center in the field of emergency preparedness. So we developed a course to prepare people in the Hospital Preparedness for Emergencies course. And that was actually eventually rolled out in different parts of Asia, and I became the regional coordinator for Johns Hopkins University, Bloomberg School of Public Health. Exciting, right? So eventually I became a board member of the World Association for Disaster and Emergency Medicine, became inducted as a fellow of the American College of Surgeons, and worked with the Committee on Trauma to bring advanced trauma life support course to the Philippines. In 2007, they invited me to the University Kebangsaan, Malaysia, to help graduate the first emergency physicians of the National University of Malaysia. I stayed there for 3 years until I realized I'm going to make Malaysia overtake the Filipinos, so I decided to come back. All this time, I did my humanitarian work with a group called Physicians for Peace. We would operate in remote areas, give prostheses to children, and eyeglasses to those that had a difficulty of seeing. And eventually, I became chairman of the board. I still sit as chairman of the board of this humanitarian organization. So my life is interesting. I was a lifesaver. I taught people how to save lives. I taught medical students, surgical residents, emergency room nurses, ambulance crew or EMTs. I taught corporate people in first aid and disaster preparedness. I taught flight nurses, flight attendants, and I even taught ministers of health at the Asian Center for Disaster. But what's more important, what's really important is that I realized that there was a whole silo outside medicine, that the world is actually a system, that I started to think about systems. So what is a system? A system is an interconnection of things, people, cells, molecules that are interconnected in a way so that they perform a specific behavior. And that's how we started to think. I grew up thinking that it should be a systems approach to our problems. Any of you know this guy? Atul Gawande. He is an idol. He is my idol. He is a surgeon, and he is also a best-selling author. And he writes for the New York Times as well. In 2004, I met him in Geneva in the World Health Organization. We were asked to do the second Global Safety Challenge with the World Health Organization. And because of that, I met the man, I read his book. His first bestseller was published in 2002. It was entitled Complication. And as a surgeon, that was very interesting to me because he talked about the people that had complications in surgery, top surgeons that eventually developed complications with their patients and how they dealt with it. But the paradigm shift that he changed was that he looked at it not from the blame culture that was the standard or the convention at that time. If something went wrong, it was the nurse's fault, the resident's fault. It was never the fault of the surgeon. He started to look at it from a systems perspective. Then he wrote another book, which was also a bestseller, and I loved it. It was called Better. He went around the world, looked at health programs and how they succeeded. He went to India and studied how remote surgeons there were able to deliver better care than the ones happening in Massachusetts, where he was. So with that collaboration, we were able to come out with a publication in the New England Journal of Medicine, the WHO Safe Surgery Checklist, an idea that is now progressive and is my most cited paper to date. Then I became appointed in 2010. So my waves, you can see from the international scheme. Now I'm appointed as an Undersecretary of Health in 2010. This is a top government position, a cabinet-level position that made me look at the whole of government and how the whole of government implements health policies, health programs, how they strategize health reforms. I was at the peak of a health totem pole. I was number 2, but I was looking at the same vantage point as my secretary. So it was different. And the systems approach and the system thinking helped a lot. So we pursued universal health coverage, or UHC, an idea that there would be coverage for all in terms of financial risk protection, quality health care, and risk pooling. So this is the classic WHO model for that. But this is what I love. The Harvard model for the control knobs of health reforms, health system reforms, by Mark Roberts of Harvard. And he equated it to something like your sound system and your equalizer when you had control knobs, treble, bass, and volume, and you tweak that. And he talked about 5 control knobs: health financing, health payment schemes, health organization, regulation of that system, and behavior or health-seeking behavior. And then you look at the health efficiency of the system, the quality of the healthcare delivered by that system, and access by the people to such a system, wherein you'll get the good health outcomes of a good health status for the population, satisfied population, and decreasing the risk of that population to illness. So what I realized that clinical care and government work was also at the same time complex. They were complex, and winning battles was difficult. You win small battles, but you don't win the whole war. And that was the difficulty. So we tried to look at other solutions. It's a digital world. So we decided to create, for the first time, one of the first 9 countries in this world to actually put an enterprise architecture in e-health. So you can download now the National E-Health Strategic Framework and Plan, which tries to utilize digital technology to improve the speed of how you implement reform using the control knobs model. Not going to talk about that, but I'll talk about another wavelength. Quickly, we realize that there is a Gartner hype cycle for innovation. We realize that an innovation trigger or an idea will get an initial strong peak of inflated expectation. And this is followed quickly by a trough of disillusionment, things that never work. And then the slow slope of enlightenment, and finally, a plateau of productivity. So this is interesting in terms of the millennial generation today. So the analogy is very nice. We talk about wavelengths. I talk about surfing waves in my career and my life. And the surfer I love because the surfer has 2 coats, because the surfer will fall, will get up, ride that surfboard again, and look for a stronger wave and a bigger wave. So that's the attitude of the surfer. And they have 2 quotes that I love. The first quote of the surfer: "We are all equal before a wave." And the second quote of the surfer: "You do not measure a wave in feet or inches. You measure it in increments of fear." So as a policymaker, I saw it was not all rosy. You'd fall out of that surfboard. And I learned that health and politics are wavelengths that intertwine. Here is what I learned in the Philippine political system. If you're at the top, you look down, everything you see is problematic. But the people down, every time they look up, anything they see are a-holes. So I'm not supposed to say the word. This is UST. So I did that well. So what is the lesson I learned when I joined politics? The 2 are intertwined. You have healthcare. To have good healthcare, you need good politics. To have good politics, you need good health reforms. So they're actually intertwined. That's the big lesson. So I go again. I resign from the Department of Health because of politics. So I join and go to my room, depressed, fell from that big surf wave that I couldn't handle, and went into a digital world. And I discovered that I had a wider audience. And my audience were millennials. It was a wider audience. So I started to study MOOCs. I volunteered for the Ebola program in WHO. I was actually accepted, and they asked me to take a MOOCs with a massive open online course with the London School of Hygiene and Tropical Medicine. Then I discovered the hashtags of Twitter. I discovered the hashtag and tweet chats of groups like Healthcare Leaders, hashtag HLDR, HCLDR, hashtag IrishMed. And then I discovered a group of young Filipino bloggers, and they called themselves hashtag HealthXPH. So in 2014, I started to join them. They invited me because of my ideas. And I joined them. It's every Saturday. Tonight, there's one. Just click on your Twitter account and join hashtag HealthXPH. But you've got to read the blog first. There is a blog post by one of them with 3 questions, and the whole world communicates in an hour. And if you visualize that communication, it's all about different wavelengths interacting with each other. Where's Teddy Bird? Teddy Bird is me, there. Look, I'm central. Because of my age and my network, Probably it looked central. So there's the other thing I saw that was powerful in hashtag. This is a big issue of today. But I did a hashtag in 2016, hashtag why rush dengue vax. And my Twitter follower said, the hashtag of Teddy Bird reads like a suspense novel and a thriller. So I invite you to go read that. So I became what is called a health warrior. I fight and advocate for good health for the people. And what is important is now I bring you to this particular concept. I bring forth again my role as a martial arts guy with Arnis. I realized that eventually we need to learn to fight. We need to learn to actually work for our health programs. So this is the Health Development Index. This is a composite statistic of life expectancy at birth, of the level of education or literacy of a country, and the per capita gross income. So countries are rated based on their HDI. And I'm very happy to say that I've been involved in healthcare, in life expectancy, and also in education. I'm now the executive vice president of the largest university in this country. I refuse to say number one because THE is the one that said we're number one in the field. Then I go lastly to another wavelength, and this is the double helix of DNA. The person in the picture is my great-grand-uncle. His sister, Lucia, has a youngest child named Stanislao, or Lolo Tan. He is my grandfather. And Lolo Tan was one of the children with Rizal in Dapitan that he got educated. Lolo Tan was my chess buddy when I was young. And he was the reason Josephine Bracken lost the child, because he was malikot. He was caught by the Josephine Bracken in one of his playful mood. He didn't fall up the stairs, but Josephine lost the baby. But I will end with how Rizal would have looked like if he was a millennial. If he was a millennial, he would be looking like this today. If he had a great-grandson, he would be looking like this. He'd be current. But his ideas of 100 years and 2 decades would still be the same. And this is my message I will leave with you. My countrymen, I have given proof that I am one most anxious for the liberties of our country, and I am still desirous of them. But I place as a prior condition the education of the people, that by means of instruction and industry, our people may have an individuality of its own and make itself worthy of these liberties. Ladies and gentlemen, go for that wave, surf that wave, get educated, go digital, and join my army of health warriors. Thank you.
Okay, so thank you very much.